Hello, and welcome to part two of your lecture on Arabic and Jewish medicine. We're going to run through more detail on Arabic medicine and the luminaries of Arabic medicine in this lecture, as well as talking about the system of Unani too. Like in our Greco-Roman lecture, we had a number of luminaries who were the real leaders of medical thought and philosophy during that time. Likewise, in the Islamic Empire, we have luminaries that were responsible for driving medicine forward during that time, and we'll touch on some of those. So the first one is Ibn Razi, and in parentheses there is his Latinized name. So you'll notice that as we go through these luminaries, we have the Arabic version of their name, which is obviously the version that they used, and then we have the Latinized version of that as well. I will use the Latinized version because it's more natural for pronunciation for me. And so Rhazes lived from about 850 CE through 930, and he was a Muslim philosopher and alchemist considered to have been the greatest physician of the period of the Islamic Empire, along with Avicenna, who we'll talk about a couple of slides from now. So he was a prolific writer and produced large medical text compilations, as did Avicenna, and the documentation that we have from this period of time comes primarily from these two men. They are also likely the best known because of how prolifically they wrote. It doesn't necessarily imply that they were the greatest thinkers of the time, but they were very prolific writers. And so they left a large body of written knowledge behind them. Rhazes had an atomic theory of composition of matter, and this was similar to Democritus, who we mentioned in the Greco-Roman lecture previously, although that was an earlier period of time that Democritus had that. So we don't know whether that atomic theory of composition of matter had migrated and Rhazes picked it up, or if he came up with that by himself. And he also engaged in what we now know as differential diagnosis, which is the idea that different diseases might have similar signs and symptoms. And so we can think of this as, think of a cold versus the flu, and how oftentimes we have people saying that they have the flu when perhaps it might be a cold, or vice versa, or having food poisoning, for example, and whether that might or might not be something that's driven by a virus versus a bacteria in the food. So he had this idea that different diseases, they might be different in terms of the way you might treat them or the way they might run their course, but they might have similar signs and symptoms. And that is something that is still used in medical diagnosis today. So Rhazes was a mathematician, he was an astronomer, an anatomist, and also obviously a physician, a philosopher, and he was an alchemist. He may have already been an alchemist before he studied medicine and became a physician, and alchemy may have led him into medicine. He was actually the first alchemist to produce acids in a laboratory setting, so actually to generate an acid, which we just sort of take for granted in the modern age, but now we know where that comes from. And he viewed himself as the Islamic Socrates in philosophy and Hippocrates in medicine. He rejected many of the teachings of Galen, but he was an avid follower of Galen's medical thought, but he would call Galen out on some of the errors that he had made. Of course, Galen was gone by then, and so Galen didn't get his feelings hurt. But he believed in the importance of really understanding anatomy to being a doctor, and he would test all of his students first on anatomy, and if they didn't pass, he wouldn't allow them to proceed in their study, even if they had already passed other clinical examinations, because he felt that failure to understand the anatomy made a person unfit to practice medicine. And we see a very similar stance on anatomy in medical education now. Certainly, we don't allow anyone to proceed in studying any sort of medicine until they study and successfully complete anatomy and physiology, for that matter. So the differential diagnosis that he used, which continues to be used today, is probably one of his most important contributions as well, and his methods of documenting the progress of illnesses and differentiating between illnesses. The image on the slide here is of Rhazes conducting a clinical examination of a patient's urine. And one of the areas of Galen's theories that he rejected relating to urinary diseases, and Rhazes had significantly more clinical experience because he worked in a hospital setting. So Galen was more of a philosopher scientist and didn't have a huge amount of directly relevant clinical experience treating patients, whereas with the development of teaching hospitals and the hospital system in the Islamic period, we have the doctors during this period having a lot more direct contact with patients and having that direct experience of watching a patient and the signs and symptoms that they might evidence. And urine was one of the areas that Rhazes actually disagreed with some of Galen's prior theories and ideas around. So Rhazes set up and ran a new hospital in Baghdad around the year 900. He wrote about 200 medical texts. Some of those were translations of Greek medical ideas, and he injected some of his own original development into those ideas from his own clinical experience. He also was very involved in the idea of ethics and the ethics of medicine, similar to the way that Hippocrates placed importance on evidence. And he did a lot of synthesizing thought from different cultures. So he took Greek, Syrian, early Persian medicine, and some Indian medicine, and he generated a synthesis of those prior periods of thought. And but he did place a lot of emphasis on having direct experience of things. And so one of his quotes is, "I never wrote about things unless I first examined them myself." So as he was synthesizing this information from other cultures, he wouldn't write about it until he had actually taken that prior thought and gotten some direct experience of it so that he could write from a perspective of experience. He organized the body into simple organs, and the simple organs were bones, nerves, muscles, veins, and arteries, and then compound organs, which were the eyes, the nose, the heart, and the intestines. And we can certainly look at the complexity of the physiology of our intestines versus the complexity of physiology of a bone or a nerve and understand the reason why he was putting those in different levels of complexity. But how he discerned that level of complexity is a little bit of an open question because they certainly didn't have the methods of investigation that we have at hand now. He was the first to utilize neuroanatomy, so the anatomy of the nervous system, to localize lesions in the nervous system and to correlate them with clinical signs. So if a person had a sign of a neurological disease or a neurological problem, he was the first to sort of localize that to different parts of the nervous system, whether it was the brain or the spinal cord or a cutaneous sensory nerve that was involved in that lesion. And he identified 7 of the cranial nerves, from the optic to the hypoglossal nerve, and you'll learn those in order as you go through your anatomy class, and also 31 of the spinal nerves. So he placed a lot of his emphasis of study on the nervous system. Maybe in conjunction with his placing importance on the nervous system, he actually used music quite a bit for promoting healing, and he was first to appreciate the influence of diet on the function of the body and the predisposition to disease. And so we have this sort of holism taking place in treatment where Rhazes is involved in treatment. He also wrote on measles and smallpox. He was the first to differentiate between those two diseases, and so this is the evidence of his differential diagnosis approach. Measles and smallpox might look quite similar on the outside of the body and also with their systemic symptoms such as fever and fatigue etc. And he was the first to actually describe the differences between those two diseases. He also explained that a fever was not a part of the illness, but an indication of the body fighting the disease. And so this is one of the first times we see a medical philosopher looking at that, and that is certainly a key component to the philosophy of, say, naturopathic medicine at this point in time in the modern world. In about 900 of the Common Era, he set up and ran a new hospital in Baghdad. And I already mentioned he was the first to describe the difference between smallpox and measles, and his description of fever as different, separate from the disease, but being actually a sign that the body was fighting the disease. And on to Avicenna, who perhaps may be well known by name more so than Rhazes. He came after Rhazes, so he lived from 980 to 1037 of the Common Era. His Arabic name was Ibn Sina, and he was the most famous of the philosopher-scientists of the medieval Islamic world. And that was primarily due to a text that he left behind that was propagated into European medicine and used as a European medical text for many centuries. He wrote over 240 books on mathematics and geometry, astronomy, metaphysics, physics, philology, geography, geology, alchemy, music, and poetry, as well as medicine. So he was had this very broad view of the sciences, and he unified the classification of all knowledge. So he had a method of classification, which I'll talk about in a second, which sort of looked at all of the sciences and categorized and sort of made a hierarchy of the sciences among all of the areas of study. So he obviously had a very comprehensive ability to look at things with a very broad view. He was an Iranian philosopher in the tradition of Aristotle, so he had a Persian ancestry or following on that tradition. And he was a renowned physician, one of the most eminent scientists and scholars of his age, and really widely recognized by modern medical history. By the age of 10, he could recite the Quran, and he began studying medicine at 16. By age 18, he was a respected court physician. So think about that, a physician to the emperor. And that is by the age of 18. So if you think about that in the realm of how we develop knowledge now, I mean, he was quite a prodigy. He began writing in terms of the texts that he wrote at age 21, and wrote, as indicated on the slide, about 240 books. And his scholarship was actually hampered, surprisingly, by having to stay on the move because of the nature of his politics and religion during that time, and the nature of how politics and religion were under attack at times across that period of time of his life. So you can only imagine if he could have stayed put and not been moving around because of religious and political influences, that he might have actually been more prolific than he was, which is hard to actually imagine. He was very apt to not adhere to the rigid rules of Islam, and he really tended in his personal behaviors towards promiscuity, heavy drinking, and he really liked lively music. He had a very mercurial wit, but he also tended to be quite arrogant, and we can imagine that he might have had some basis for that arrogance based upon the amount of scholarship that he left behind. So I mentioned a little earlier about his classification of knowledge, and some examples of the way that he classified the difference in different sciences. He looked at physics. He looked at the lens of nature through. He looked at nature through the lens of physics. And looked at that as nature as being comprised of 8 principal sciences: a science of general principles, of celestial and terrestrial bodies, of primary elements. So we might think of that like the elements we might think about in the periodic table, but that had not been established at that time. Meteorology, mineralogy, botany, zoology, and psychology, which was the science of the soul. And so he saw those as being sort of the primary sciences. And then he had a system of subordinate sciences, and this was in order of importance: medicine, astrology, physiognomy, the study of the correspondence of psychological characteristics to physical structure, the art of dream interpretation, talismans, objects which are objects with magical power to blend the celestial forces with the forces of the particularly worldly bodies. And we'll talk more about talismans when we get into traditional Jewish medicine a bit later. So he had this hierarchy of sciences, and medicine he put as a subordinate science to the larger realms of science, which he saw as being predominantly the major manifestations of nature. Additionally, alchemy was a subordinate science as well as mathematics. And so that's sort of interesting because at this point in time, looking at nature and perhaps particularly looking at quantum physics as a realm of science that might perhaps be the umbrella over everything, mathematics is pretty high up in the hierarchy at this point in time. So he was obviously a very comprehensive thinker. So I mentioned his book, The Canon of Medicine, and this is perhaps why he's the most well-known of the Arabic scholars that came from this time and was the bridge of Greco-Roman thought into Europe. The Canon of Medicine was his greatest medical text, and it was completed in the year 1025. It was the most comprehensive medical text that had been written to date. And it's important to note that when I say a medical text, it was not a single book. It was multiple volumes. So it's more like an encyclopedia of diseases, and it named causes and symptoms of disease, suggested treatments of disease, and it was comprised of 5 books. There was a translation of the Canon of Medicine from the Arabic to Latin, and that was how ancient Greek medical knowledge was transmitted to Europe. And as I mentioned, the Canon of Medicine was used as a medical text in medieval Europe and going forward in Europe for many centuries. So a little historical context around this. From the 11th to the 17th centuries in the Islamic world in Europe, the scientific and educational activities were really under great influence by the Canon of Medicine, it being the main medical text that was used. And it was then translated into many other languages as it was propagated as a medical text across Europe until the 17th century. It leaned very, very heavily on Galen's thought and Hippocrates as influences, but it was also considered innovative on its own. And that was because Avicenna actually augmented the Galenic and Hippocratic knowledge with his own knowledge and many of his own new ideas from his experience as a physician. For instance, he thought that tuberculosis was catching, even though most Europeans at that time thought that it was not. So there were some new ideas showing up there in terms of the idea of contagion of diseases. So as it says on the slide, it was divided into 5 books. The first book had 4 treatises, and the first treatise of the first book dealt with the 4 elements, which we'll talk quite a bit more about. But you'll remember the 4 and 5 element systems from our prior lectures. That first treatise also included anatomy, so this perhaps provided an insight into what he thought were sort of the basic things of importance to medicine, and the 4 elements and anatomy both showed up very primary there. The second treatise looked at the cause and symptoms of disease. The third covered hygiene, health and sickness, and the inevitability of death. And the 4th treatise was a therapeutic classification of diseases, so classifying diseases by what treatments they would benefit from. And then there was also a general overview of regimens and dietary treatments. The second book of the canon was a Materia Medica of medicines of the time. The third book covered diseases head to toe, so we might think of that like a pathology textbook. And the fourth book examined diseases that are not specific to certain organs. So that would have been like fevers or other systemic diseases or humoral pathologies. And we'll talk more about the 4 humors, but you'll probably remember that from our last lecture. And then the fifth book presented compound drugs. So a Materia Medica would be single therapeutic agents, like a single plant or a single mineral, versus the fourth book, which was compound drugs. So a formulary of how to combine different types of individual therapeutic agents to produce a combined therapeutic drug. The books 2 and 5, the Materia Medica and the Book of Compound Drugs, had about 760 simple and compound drugs together. The canon of medicine was, again, how we had this transmission of knowledge into Europe, and the mainstream European medical establishment was dedicated to this book and to the use of this book throughout the later history of Europe and medieval Europe. And we'll see how seriously they took this when we talk about Paracelsus in our next lecture and the treatment that Paracelsus received when he rejected the canon of medicine as the seminal text of medicine. So some of the more detailed contributions that Avicenna made to medicine, he made a correlation of sweetness of the urine to diabetes. And so you can see this attentiveness to urine as a diagnostic tool that we also saw with Rhazes. The treatment that he made of asthma was considered more effective than modern medicine is even now. His treatment of liver disease was in alignment with modern research, even in the present. He used wine as a wound dressing, and that was commonly used also in medieval Europe. And so while there may not have been certainly there was not an understanding of germ theory at that point in time, there was an understanding of alcohol being something that would help prevent infection. And he also reduced spinal deformities using pressure and traction. When I use the word reduction, I mean the realignment of spinal deformities using pressure and traction. And so his treatment of the spinal deformities actually flowed on to an approach that Hippocrates had first used and documented. So this is an evidence of Avicenna using the prior knowledge of Hippocrates and then expanding on that. And he had that had also been expanded by some later Greek physicians after Hippocrates. And the straightening of the spine was something that was, after the time of Avicenna, was not really used again until the French surgeon Jean-Francois Calot reintroduced that practice in the very late 1800s. So there was this gap of time between when Avicenna was doing this and when it was actually picked up by Western medicine. I had made a general statement about it being this unclear thing, whether the physicians of this time were engaging directly in human dissection, and this is certainly true of Avicenna. Most of his descriptions of the structures of the human body were novel for his time, so the things that he added into anatomical knowledge were actually new ideas, and it maybe infers that he was engaging secretly in human dissection. Some believe that he did engage in dissection in secret, but there's not any firm documentation of that we know. He presented anatomy by system, followed by the diseases of that system, so he made the study of anatomy more clinically oriented. And one example was that he described the tricuspid valve of the aorta and all of its functions 6 centuries before the eventual description of the route and function of blood circulation in the body before that was actually fully and accurately described. And so it is hard to imagine that he could have described that function of the tricuspid valve unless he was engaging in dissection, but it could have been animal dissection. We know that, for example, pig heart valves bear a lot of similarity to human ones and are actually used in transplants in modern times. So the image here on this slide is of Avicenna's tomb. That's a pilgrimage site in Iran to this day. And for visitors to this tomb as a pilgrimage, cures are said to be not uncommon. Shifting over to a Jewish physician and scholar, we'll take him up in this section of the lecture rather than in the traditional Jewish medicine section in the next part, because despite his being Jewish, he practiced and functioned primarily in the same spheres as the famous Arabic doctors of his time. And he was likewise a very accomplished scholar, though his scholarship was more closely related to his religion than others of his time. So his name was Moses ben Maimon, and his Latinized name was Maimonides. He was born in 1135 in Islamic Spain, and he died in 1204 in Egypt. So like Avicenna, he was on the move for a lot of his life, and a lot of that was about the political and religious influences of the time. The image on the slide is actually also his grave site. It is at Tiberias, Israel, and it is also a place that people go on pilgrimage to as a religious pilgrimage, as a healing pursuit. So very similar to Avicenna's tomb. So as I said, he was a philosopher. He was also a scholar, a physician. He was a jurist, and this is something that we don't see across that many of the doctors, that they were also involved in law. Foremost intellectual figure of medieval Judaism. So he was very well-rounded, similar to the Arabic physicians of his time. Also similar to the Arabic physicians, he wrote many important texts on religion, philosophy, and medicine, and he influenced both Jewish and non-Jewish scholars. But it is, again, important to note that his texts were much more closely tied to his religion. As I mentioned, Avicenna, for example, didn't strictly adhere to the tenets of Islam, and so religion was much less a feature of his writing, whereas Maimonides really had this very close tie of religion into his texts. He started writing his major works at age 23, and he wrote in both Hebrew and in Arabic. Most of his texts were actually on Jewish religion and its laws, and were not on medicine at all. He moved around a lot, as I said, to avoid religious oppression by Islamic extremists, and Egypt actually became his permanent home because he could practice and study Judaism there freely, and it was there that he started his first practice as a physician, so when he branched out from just religious writing on into medicine. Probably his most popular book in medicine was a collection of health rules that became very famous and really stressed preventative medicine and a healthy lifestyle. And his medical teachings were considered quite modern in both tone and content for their time, and really served as a significant contribution to the history of medical science. He became the court physician to the Sultan Saladin, who I'm sure that you probably have heard of, and was a very, very famous physician because of that. Saladin was a famous Muslim military leader, but he also continued in private practice and lecturing while also becoming a leading member of the Jewish community in Egypt. And he helped the Jews with personal and communal problems quite a great deal. So his medical practice was probably something along the lines of being a cultural or societal counselor, as well as being a physician, and that I suppose you could consider that an aspect of sort of holistic medicine, helping people with cultural issues or religious issues as well, although he was not a rabbi. His religious writings were actually an influence on St. Thomas Aquinas, who I'm sure that you've also heard of. And this was particularly his book that was entitled A Guide for the Perplexed. And I think that might be one of the most fantastic titles of a religious text that I think I've ever heard, A Guide for the Perplexed. And that was a comprehensive text that covered all of his philosophical views and was very, very controversial in the Jewish community, as you might imagine that a religious text that implied confusion in its title might be. So he also wrote a Materia Medica that included a number of plants with psychoactive effects, and his treatments often addressed psychosomatic factors in illness. And he gave importance to, this is a quote, rectifying the state of the psyche by removing the passions. He recorded over 100 drugs that he used to treat melancholy, so that's just psychoactive drugs used to treat melancholy, over 100 of them, and 24 of those were the ones that he used most frequently. About 2/3 of those considered against what we know today in terms of psychological unrest or imbalance would have had some sort of effect as either a sedative, a neuroprotective, or a mood enhancer. So he was working with different medicines to really influence the psychological state of his patients, and that was very forward-thinking for that time. Other medical scholars that we want to make mention of before we go on and start talking about the medical philosophies of the time. Again, I'm not going to try and pronounce the Arabic versions of these names, but Masuya was a Persian Christian physician, so he's notable for having been a Christian, and he did a number of original anatomical studies. And so he was born in Baghdad, and he performed his dissection on apes in order to learn more about human anatomy, and he wrote a number of anatomical and medical treatises in Arabic. He also wrote the first Arabic treatise on diet, and this represented a sort of transitional period in Arabic medicine when physicians really moved from focusing on translating Greek texts to actually developing their own original medical studies and practices. And this was before the time of Rhazes and Avicenna, so he came before them. Abu Qasis was later on. He was after Rhazes and sort of a contemporary of Avicenna. He was considered the greatest Arabic medieval surgeon, and he shaped European surgical procedures until the Renaissance. And he wrote a comprehensive text combining Middle Eastern and Greco-Roman classical teachings in surgery, and that really shaped European surgical procedures up until the Renaissance, being a major influence on Christian Europe. His book on surgery was called The Method, and it was a medical work in 30 parts, so it was, again, a compendium of medical knowledge. And he included the earliest known description of hemophilia, which is a clotting disorder, and also in his last chapter included drawings of more than 200 surgical instruments. And the image here is a page from his text showing his drawings of his surgical instruments. He was preferred, or his books were preferred even to Galen's works as a surgical text because he wrote in a more concise and lucid way. And so his surgical texts were used for about 500 years as the leading textbooks in surgery. On to Arabic medicine in a broader sense as we move away from talking about the luminaries of that time. So Arabic towns and cities had hospitals, and often more than one, and they cared for the sick and also trained doctors. And we'll contrast this to some of the European practices in developing hospitals in medieval Europe in our next lecture, because primarily at that time, hospitals were charitable institutions. They weren't about medicine. They were more about taking in people who didn't have any other place to go and making sure that they were fed. So there's a bit of a difference here in the way that hospitals were developing at this point in Islamic history. So hospitals usually had medical and surgical wards, a surgical room, a pharmacy, a clinic, a library, a lecture room, a chapel, and a mosque. Some hospitals included musicians and singers being brought in to comfort the patients with a type of music therapy. And hospitals served all people. No one was turned away. The image here is of an Islamic mosque hospital from the 13th century that's located in modern-day Turkey. Doctors once trained were given a license to practice, and then they could choose to stay and work in a hospital, or they could set up a private practice. But at that time, there were also non-trained practitioners that existed, and they weren't stopped from practicing. So the license to practice medicine didn't create the definition between someone who practiced and someone who didn't. You could still practice even if you didn't have a license. Doctors at this point in time were a mix of Muslims, Jews, and Christians, and not all of them were native to the region. And so, as I mentioned earlier, the hospitals had both a chapel and a mosque, and this would have reflected the fact that the culture at the time was really a mixture of different religions, and that was certainly true of the doctors. And surgeons were held in lower regard than physicians at this point in time. And that's true in other times as well. That may have been because of the fact that infection was not well understood and anatomy was not as well understood as we know it now, that surgeons probably had less success with treating people and bringing them back to health because of problems with infection. And so they may have been held as surgery being inferior to medicine for that reason. But they probably were dealing with more severe medical issues as well. So it's kind of an unfair judgment, perhaps. So moving on to Unani Tib. Unani Tib is the whole medical system that was practiced at this time, as opposed to sort of the fragmented kind of migration of knowledge that I've been talking about through this part. So the word Unani, the root of that means Greek or Ionian, and Tib means medicine. So the literal translation of this in Arabic is Greek medicine. However, when a term is used now, it is considered to mean the version of Greek-rooted medicine that was practiced in the Arabic culture. So sometimes it'll be translated as Greco-Arabic medicine, as I've said earlier. And so it's just really important to acknowledge that's not a literal translation when we say Greco-Arabic medicine for this term. So this was the whole medical system that developed during the Arab civilization out of the Greek system of humoral medicine, which we talked about in our last session. And the foundational treatise of this was, of course, the book we've already talked about, Avicenna's Canon of Medicine. The system dates from around 750 to 1000 CE in the early Islamic period. So the system actually predates Avicenna's Canon of Medicine. And this is because that Greek knowledge was already moving and being translated prior to Avicenna's life and prior to Rhazes as well. It is based on Greek humoral medicine, and it was developed further, though, by Muslim, Christian, and Jewish scholars in the Islamic Empire, and it was very much supported by Muslim rulers who were keen to develop medical and scientific knowledge, as I mentioned earlier in the lecture. And then it went on to be translated into Latin and transmitted into Europe to become the basis of European medicine in the European Middle Ages. So back to the four temperaments. We mentioned these in the Greco-Roman lecture last time. And so this is just a quick review, a reminder from our last session about the four temperaments and the four humors and their relationship to the four elements. So the sanguine temperament being associated with the element air and the humor of blood, the choleric temperament being associated with the humor of yellow bile and the element of fire, the melancholic being associated with the humor of black bile and the element of earth, and the phlegmatic temperament being associated with the humor of phlegm and the element of water. The temperament is an individual's physical constitution and susceptibilities and tendencies within an elemental framework. And so we have this concept of temperament following on from Greek humoral theory and the four elements. And we have Galen, perhaps you remember, as being the first to associate temperament to behavioral and emotional inclinations. But on top of this, Avicenna really expanded this and created some basic personality traits to be associated with each temperament, including emotional aspects, mental capacities, moral attitudes, self-awareness, movement, and dreams. You'll remember that I mentioned dream interpretation as being one of his sciences that he classified as a secondary science. So the four humors and temperaments formed the basis of Western medicine moving forward. And in some circles of medicine and psychology, this lasted on up until the middle of the 20th century in a pretty robust way. And some folks still practice herbalism these days in this type of elemental temperamental framework. In Unani Tib, health is said to occur when the overall quality of the humors is in harmony with the overall quality of the temperament of the individual, and the humors are in balance as influenced by lifestyle factors. So we see this commonality of the balance of the elements, the balance of the humors that's come from the earlier systems. And if you go into your assigned reading for today, there are detailed descriptions of each one of the four temperaments. So you can go have a read through those and consider which of those might apply to you. It might be more than one, and you can have some fun with that. But also, as you read, consider the similarities to your study of the doshas in Ayurveda or the elements in Chinese medicine from our past lectures. So the temperament of a person is the dominant humor in their body, and imbalance in the temperament predisposes the body and mind to various diseases. The temperament will represent the physical constitution and the tendencies of mood or emotional state or personality, but it's also physical. So these days we would use the word temperament to mean somebody's sort of personality traits or how their mood flows. But in this system, temperament also refers to physical things showing up in a person's body in relation to the humors. And then an imbalance of the temperaments predisposes the body to various types of diseases. And also the temperament will guide the maintenance and preservation of a person's health. So lifestyle qualities are important: air, water, food, rest, activity levels, type of work or amount of work, elimination of wastes, sleep, etc. is going to influence the balance or imbalance of the temperament. So we see this commonality with particularly the doshas from the Ayurvedic study and the Greco-Roman for humors as well. Drugs and food are also classified by their temperament. So we could say that a food has a sanguine temperament. And that means that it will have a specific influence on the balance of the humors based upon that classification of the drug, or how it might influence the mix of elements in a person's body. And so going to the healing principles of Unani Tib here, we have 6 essential factors that are considered important to influencing the temperament: the ambient air, food and drink, physical activity and rest, emotions and feelings, sleep and wakefulness, the retention of fluids, and the evacuation of waste. And the principles of Unani Tib call for using the gentlest treatment possible, used to restore the balance of the humors. Muslims, like Christians and Greco-Romans before them, actually still believed that diseases could be sent by God. And while Christians were placing emphasis on prayer and fasting and repenting sins in order to remedy that cause, Islamic medicine actually emphasized the use of medicines. And this is probably because Islamic medicine was working much more in the realm of alchemy, early chemistry, and the production of medicines or purification of medicines to more powerful forms through alchemy. Their belief was that Allah would have not brought suffering without providing a remedy for it. So they looked for their remedies in nature versus looking at appeasing God or repenting sin as a way to remove illness. So health is obviously then maintained with these principles by knowing your own temperament, or the doctor knowing your temperament and advising you on that, and then knowing how to eat, how to live, and how to medicate properly for that temperament. So this is very, very similar to the doshas in Ayurveda. You won't get the correspondence of the elements and the qualities of the elements to the doshas like you might want to see a one-to-one correspondence of that if you put them side by side, but the principles are almost exactly the same. And with the use of medication here, the purpose of the use of a medication, primarily herbs and minerals, but also foods, would be to change the balance of the humors in the body. So the doctor in Arabic medicine was called the Hakim, and it was his job or her job to keep the individual's temperament internally balanced and in harmony with their environment, and using the gentlest treatments possible to restore balance, often using diet, lifestyle, and exercise. Healing practices in this time were based on clinical observation and recording signs and symptoms. So you remember me talking about Razes and the way that he observed and differentiated signs and symptoms to different diseases. The materia medica of Arabic medicine became quite blended with that of Ayurveda, and there were great advances then in drug preparation and other methods of chemistry, such as distillation, which we've talked about earlier. Particularly important was the advance in the methods of anesthesia, but surgery was considered only a last resort. So this wasn't something that, because we can now do this, we can anesthetize somebody in order to do it. We aren't going to be doing it more because of that. We're still considering that as last resort. So whilst Arabic doctors were using Hippocratic and Galenic medicine with a focus on balancing the four humors, there was in Arabic medicine this emphasis on clinical observation that we really didn't see with the Hippocratic and Galenic doctors that came before the Arabic time. And this was a really important in the development of medicine in terms of what could be observed by recording case studies in a very detailed way. The methods of anesthesia that they developed involved using a sponge soaked in extracts of opium, and the image on this slide is actually an opium poppy from which that was extracted, and hashish, and that was placed over the nostrils for the patient to inhale. Also, the sponge could be actually placed into the nostrils, and there was an absorption of the constituents of those plants through the mucous membranes. And the belief was that a surgeon should never operate unless they know exactly what they're going in to do. So there was, again, this emphasis on it being last resort and really knowing what they were going in for, knowing what was there and what they were going to do with it. Were they going in to remove something that shouldn't be there, for example? Or were they going in to correct a tissue damage that had happened from an injury? They used cautery to seal surgical and other wounds in order to stop bleeding and to prevent the entry of infection. And certainly with anesthetic being used, cautery, which had been used in other times before, use of a heated metal instrument to seal off bleeding vessels, it would have been much less painless, or much more painless to do that under anesthetic than doing that without anesthetic, as it has been done previously. They were very skilled in eye operations, such as removing cataracts or removal of tumors, as well as setting bones and reducing dislocated joints. And again, reduction in this context means changing the shape of moving something back into the place where it's meant to be, and also stitching up wounds. The dentists of this time were actually more skilled and careful than Western dentists are at this time, and they even created sets of false teeth out of bone. So I think that's sort of interesting. By the 11th century, there was a blend of Unani Tib with Ayurveda. A great sharing of substances and plants was taking place. And in modern practice, Unani Tib actually persists quite robustly in India, Pakistan, and in Bangladesh. So this is the end of part 2. Here are your revision questions, which are also on the LMS, and other food for thought. Many aspects of Greco-Arabic medicine migrated to Western Europe, whilst others did not, such as anesthesia and hygiene. Why do you think that is? Why do you think that we didn't get migration of all of that thought, but just bits and pieces? So thank you for joining, and I'll see you in part 3.